The Health and Lifestyle of Aboriginal and Torres Strait Islanders, presented by Daniel McKenna. Good afternoon, my name is Daniel McKenna, and today I'll be presenting on the following. Analysis of the social, cultural and economic influences on health and lifestyle of Aboriginal and Torres Strait Islanders in Australia. Why and how the government influences Aboriginal and Torres Strait Islanders' health and lifestyle, mainly looking at the initiative of closing the gap. And lastly, we'll look at the implications for health and lifestyle businesses as a result of this. Aboriginal and Torres Strait Islanders are often talked about when it comes to health. Aboriginal and Torres Strait Islanders have a significant lower life expectancy than that of any non-Indigenous person. For the Aboriginal and Torres Strait Islander population born in 2010 to 2012, the life expectancy was estimated to be 10.6 years lower than that of any non-Indigenous population. For males, it is 69.1 years compared with that to 79.7, and 9.5 years for females, 73.7 compared with 81. Cardiovascular disease, cancer, diabetes, and mental health issues are all common diseases within the Aboriginal community. Therefore, it is extremely important that we understand the social, cultural, and economic influence on Aboriginal and Torres Strait Islanders. Firstly, we'll start off with what are social factors that influence health. Social factors that influence health are markers that distinguish major differences between groups of people in a given society. These markers include education, income and occupation, ethnicity and race, religion, political affiliation, and geographical region. All of these markers play a huge role in influencing the health and lifestyle of Aboriginal and Torres Strait Islanders. In this presentation, we'll focus on income and occupation. Income equality is argued to have an effect on the direct health of an individual, and in this case, the effect on the health of lifestyle of Aboriginals. According to the Australian Bureau of Statistics, Aboriginal and Torres Strait Islander people experience a range of relative disadvantages, including low household economic well-being, lower levels of employment and education or attainment relative to that of non-Indigenous people. Those with very low income, for example, often lack resources and access to nutritious food, adequate housing, safe walking paths and working conditions which can impact negatively on their health. For example, in Aboriginal and Torres Strait Islander communities, the risk of cardiovascular disease, diabetes, cancer and mental health issues are much higher than that of non-Indigenous communities. Moving on to cultural influences. Culture plays a major role in health and lifestyle. Culture refers to an integrated pattern of belief and behaviour. It varies from local group to group. It is valid for itself and endures and evolves over time. The Aboriginal and Torres Strait culture is one that has evolved over hundreds of years. The influence of culture on health is vast. It affects perceptions on health, illness and death, beliefs about causes of disease, approaches to health promotion, how illness and pain are experienced and expressed, where patients seek help, and the types of treatment patients prefer. An example of this for Aboriginal and Torres Strait Islanders is that illness is perceived by Aboriginals and Torres Strait Islanders as a soreness of the spirit, caused by loss of social and family networks, destructions of kinship and family, dislocation from ancestral land, and the conflict between tradition and the pressures of trying to exist within and alongside European culture. Torres Strait Islanders, there is less focus on the actual cause of the disease and how to prevent them. This can be somewhat related to the lack of education, but mainly the embedment of Aboriginal culture in their communities. A report by Leon Feinstein, Ricardo Sabates, Tashwika Anderson, Anik Sohando, and Kathy Hammond suggests that economic factors are the largest single predictor or driver of health-related outcomes. The lower the social and economic position of a population or community, the more common are unhealthy behaviours and the more difficult it is to practice healthy ones. However, the better the economic position of a community, the more possible and likely it is to adopt and sustain better health behaviours. Aboriginal communities often fall into the category of being poor. As a result of this, they heavily rely on government funding for any medical facilities or programs. As a result of not being able to access these facilities or fundings, the risk of cardiovascular disease, cancer, diabetes, and mental health is extremely high. So how does the government influence Aboriginal and Torres Strait Islanders' health and lifestyle? Closing the gap is a strategy that aims to reduce Indigenous disadvantage with respect to life expectancy, child mortality, access to early childhood education, educational achievement, and employment outcomes. It has been identified by the Australian government that the health of Aboriginal people is extremely important. Indigenous access to adequate preventative and comprehensive health care is essential to reduce excess deaths and close the gap in early childhood mortality and life expectancy. Just a couple of examples of programs or initiatives, funds going into the Aboriginal communities are $3.3 billion over 4 years from 2016 for primary health care and supporting infrastructure through Indigenous Australians Health Program. An increase of over $500 million compared to previous 4 years. $85 million over 3 years from July 2016 to improve access to culturally sensitive integrated mental health services for Aboriginal and Torres Strait Islander people. $241 million over 4 years from July 2016 for local alcohol and drug treatment services in response to the National ICE Task Force final report, including a substantial investment in local Aboriginal and Torres Strait Islander services, within close involvement of Aboriginal community-controlled health services. As a result of the increased awareness of health and lifestyle businesses are on the rise, in particular gyms, health stores, and local medical facilities. Apart from the obvious implications on these health and lifestyle businesses, like increased profit and increased revenue, due to the increased education about the importance of healthy eating, vaccination, physical activity, there are also a number of possible business opportunities for Aboriginal and Torres Strait Islander communities. The biggest gains in Indigenous employment and prosperity are likely to be in regional and urban areas, where there are more market opportunities and where the majority of Aboriginal and Torres Strait Islander people live. A great example of this will be to set up an Aboriginal and Torres Strait Islander gym with various other facilities, including healthy eating, cafes, anything. This would be in high demand once the proper education and awareness is in place for Aboriginal communities. In conclusion, this video has analysed the social factors that influence health, in particular income. It has analysed the cultural factors that influence health and lifestyle for Aboriginals, and it has also analysed the economic factors that influence health and lifestyle for Aboriginal and Torres Strait Islanders. It has also discussed why and how the government influences Aboriginal and Torres Strait Islanders' health and lifestyle, mainly looking at the initiative of closing the gap. And lastly, we've looked at implications for health and lifestyle businesses. Thank you.